Hi, good morning. Just for sake of time, I'm going to go ahead and get started. Welcome to today's panel, Making It Matter, Strategies for Increasing Staff and Patient Utilization. My name is Jocelyn Ohnmeis, and I am the Clinical Director for Pediatric and Government Services for GetWell Network. During today's panel session, our presenters from Boston Children's Hospital, with support from GetWell Network Client Service Manager and CS Mott Children's Hospital, will share their experiences and successes. Today, we're excited to hear how these two facilities significantly improved education utilization and the approaches that each facility deployed. We'll hear our presenters discuss the technology acceptance model and the patient education and engagement plans, or PEEP, as frameworks to support staff adoption of GetWell Network solutions, drive utilization, and enhance the patient and family experience. After from hearing our presenters, I'll open the floor to you so you can ask questions and share your experiences around this topic. Just a note about this, they are recording, so we are going to ask that any questions that you use your mic, so Derek here will be helping to facilitate the flow of that. With your participation, the session will provide a great opportunity to exchange ideas and best practices. I am pleased to begin this morning's presentation by presenting our presenters. Unfortunately, Kristen Barton, who is integral to this initiative at Boston Children's, was unable to attend the conference. She is the Program Manager for Health Literacy, Patient and Family Education, and Communications at Boston Children's Hospital. Our Pediatric Client Service Manager, Nikia, will present slides on her behalf. Nikia Whitaker joined the GetWell Network team in April of 2019 and has been successful at building trusting relationships with their clients and has helped multiple sites optimize their GetWell Network experiences. Prior to joining GetWell Network, Nikia spent 11 years working at Dayton Children's Hospital and most recently held a position as the Clinical Technology Integration Manager. Kaylee Hauser is a quality improvement data analyst in quality and professional practice for nursing and patient care, as well as the surgical quality program at Boston Children's Hospital. Kaylee works to support a multitude of quality projects across the hospital, including management of GetWell Network data. She is a proud alum of the University of Notre Dame and holds a master's degree in global health from Boston University School of Public Health. Sue Roebuck, who's a bachelor's of science in nursing and a registered nurse, is a certified pediatric nurse and educational nurse coordinator. Sue has 33 years as a pediatric registered nurse, and for the last 7, she has been in the role as education nurse coordinator for an inpatient unit at CS Mott Children's Hospital. Catherine Doherty is a certified nurse manager and leader that holds the position as clinical nurse supervisor at CS Mott Children's Hospital. Kathy has 33 years as a pediatric registered nurse. Over the last 8 years, she's been a clinical nurse supervisor on a 32-bed acute care med-surg pediatric unit. Melissa Dyer has a master's degree in public health. She is a project manager at University of Michigan CS Mott Children's Hospital and Von Voigtlander Women's Hospital. She has over 18 years of experience at Michigan Medicine. Before we get started, I need to share a disclosure statement with you related to nursing education credits that are being offered for this session. The Maryland Nurses Association is an accredited approver of continuing nursing education by the American Nurses Credentialing Centers Commission on Accreditation. If you wish to receive credit for attending this activity, you must complete the session survey found on your conference mobile app. In the survey, it is important that you check the box indicating that you would like to receive credit and enter your full name and email address in the space provided. Your certificate will be sent to that address. In compliance with the continuing education activity credit conflict of interest disclosure requirements, we'd like to announce that the presenters of this session have no commercial association that would create a conflict of interest. With that, I am going to hand it off to Nikia Whitaker. Welcome, Nikia.
Thank you, Jocelyn. All right, good morning, everybody. As Jocelyn mentioned, I'm Nikia. I'm the CSM working with Boston Children's. Kristen, she was very upset she couldn't be here today. It was more of a last-minute thing that came up for her. So all credit for slides definitely go to her and Kaylee. And if you guys happen to know Kristen, regardless how you feel about my presentation, tell her I nailed it. All right? I need that relationship there. But I do feel very honored, though, that she trusted her presentation to me. So I definitely am excited to be here today to share it with you guys. So what we've been working on is strategies for increasing that staff and patient utilization of Get Well Network. Our goal is to review Boston Children's as a whole and how they partner with us at Get Well Network. We're going to review their past utilization and their goals for that increasing their health utilization especially. We're going to talk through the technology acceptance model framework and how that was used to framework what they've done this past year. And some interventions we'll review that they've been really successful in increasing their utilization by 47%, and then talk through our future goals for this upcoming year. So Boston Children's as a whole is a 415 licensed bed hospital. They do have satellite locations, a community health center, 18 hospital and health center affiliations, and they do great care for their pediatric patients. They're very proud of their 3 consecutive magnet nomination or recognitions, so magnet designation. And then just a background, they are integrated with both Epic and Cerner. Actually, they use Epic for their ADT system and then Cerner PowerChart for their orders and documentation. So to review the kind of background and where we are today with the Boston and Get Well Network partnership, they started their relationship with us in 2016, so across 16 and 17, they implemented in all their inpatient areas, excluding their ICUs at that time, and they also integrated with their portal, so their patients have access to that education and medication teaching from home. In 2018, they continued to implement into their ICU areas, their NICU with the iPad setup, procedural areas, centers for their families, and some satellite locations as well with infusion clinics. They were piloting whiteboard. They piloted a student volunteer rounding program that we'll talk through. And they also recognize the importance of including care members beyond nurses to really help identify that education for their patients. So they worked through giving their Child Life team access to PowerChart to order those education videos for their patients as well. Through 2019, this is when we really started actually past that implementation phase and how can we optimize the solution that we have. So I'll talk through some of the interventions that we were able to work through and then through our 2020 goals. I'm going to have Kaylee go ahead and talk about some of that past utilization data.
Okay, so to sort of set the stage before we got into the interventions of 2019, this is our data from our go live in Q3 of 2016 through the end of 2018. And sort of the overall message you can take from this is that the numbers really don't change. We average at like 80% or so for orientation videos, around 60% for entertainment, and then our focus on the health education usage, if you look at the magenta bar, stays at about 15 to 16% throughout this whole time period. We'll dig into that a little bit more here, looking at the prescribed education videos ordered versus completed. You can see we have some pretty high numbers initially, and that's as we continued to go live in different areas across the hospital. And that's to be expected with any sort of rollout, that there's a lot of excitement around the system right when it's introduced. But we kind of fell back into the steady state, and the numbers leveled off for the rest of 2017 and 2018. Then we looked at our family satisfaction with the videos. So as the families and patients watch the videos, they can respond with one of the faces. So we pulled out the response to the health education video specifically and found that 62% of our patients responded with a happy face and only 1% with a sad face. There's another 33% that didn't respond in here, but still 62% is definitely showed us that a majority of our patients found the videos useful, they liked the videos, and that was really encouraging us, and was a reason in part why we felt this is a really great form of education and something that we should be pushing and get more engagement with.
So through those numbers and realizing again that the families like those education videos, they selected that goal in 2019 to really focus on increasing that utilization. Their set goal was to increase it by a 20% utilization rate, and then they were able to actually increase it by 47% And they were also able to even increase the amount of prescribed videos by staff by 140%. So we'll talk through how they're able to achieve that.
So now we can see this 2019 data, and it started at 15% in January, and we sort of steadily grew through the end of the year, reaching 22% in December. So that is a 47% increase and something we were really happy to see. Not reflected on this graph, in January of this year we reached 27%. So we're happy to see the numbers keep climbing, but of course the issue is sustainability and keeping the growth, or at least maintaining this higher level. And again, if we look at prescribed, ordered versus completed videos for 2019, you see sort of the same growth. There is that big spike in the middle of the year. We went live in June with our asthma pathway, which Nakia will talk about more later, but again, so there's sort of a spike from that. But you can still see that we had a marked increase from, I believe it's 63 in January to 151 videos ordered in December.
So to begin, once they established the goal and they were ready to begin their interventions, they really took a step back and was looking at, what framework can they go off of to make these interventions successful. So they enlisted the help of a master's in public health student, and really dove into research, did some staff interviews, and they decided to build their foundation around the technology acceptance model. So this model came around from an IS professor in 1989 that really goes around the fact that how users come to accept and use technology, and how do we reach that. And one of the key things identified is that importance of perceived usefulness and the ease of the use of the system itself. So 4 major interventions that we decided on in 2019 is looking at how do we revamp data and dissemination strategy. So Boston has done a great job at disseminating their data, but it wasn't meaningful. So they had very rich information, but realistically, when people get those emails and get those documents, they don't look at it. So Kaylee will talk through how they actually revamped what data they were sending. That way it became important to those individuals. They also focused on the addition of custom video. So we know, especially in pediatrics, there's gaps in education. And as Boston Children's being very specialized, they see a lot of unique patients. So how can they go through, create custom videos that become meaningful to the nurses that are prescribing them and the patients that are watching them? And then also with that, focusing on some disease-specific, diagnosis-specific education. And then the last thing that we focused on was how can we simplify the system for staff, patients, and families to use.
So the first thing is this data revamp, which honestly is a really simplistic idea, but was effective. There's really just 2 main components. It's that we started disseminating the data consistently on a monthly basis, and that we created meaningful graphs for the staff. So by sending it on a monthly basis, we kept our unit staff engaged and aware of how they were doing. And we did see results from this, and in a lot of nurses coming back to us asking for things like re-education on the system, or custom content, or signage or tools to help awareness of the system and things like that. And we also, because we send both hospital number and unit numbers, we found a healthy sense of competition between the units, and people seeing that other units were doing better and their numbers were low, and asking, well, how can we be as good as they are? So that was really great. And in terms of creating meaningful graphs for staff, I think that differs for everyone. So your organizations, it might mean something different than it means at Children's, but the graphs we show are pretty similar to what I just showed you guys, and we really just felt that, as Nakia mentioned, we had all of this data and we had pretty complex data, but giving that to the staff isn't useful. They're busy people and they don't have the time to really sift through it all and pull out the meaning. So we really just wanted simplified data that quickly gets across what we want them to know.
The next piece is the addition of their custom content. So luckily for Kristen, she had a graphic designer that is a member of her patient and family education team. And that person could draw really well. So they got on Amazon and purchased the smartphone video microphone kit for around $50. enlisted the help of their graphic designer and are creating a whiteboard style videos. Of course, we love kids' health videos with the real people, the real patients, but this is a quick method to get that information to the patients pretty quickly. So as you can see, they've added in 110 custom videos, and these are still coming in. I even have an open ticket for them right now for 4 more custom videos. So it's very exciting for them to be able to get that uploaded, and this is hitting on that meaningful education. So it's talking with the staff, like, what are you educating your patients on? Where are their gaps? And with that, Kristen is now getting an influx of people like, create a video for this. So that's one thing they're working on now, is establishing a plan for managing what requests are coming in. They use their steering committee to help prioritize which videos are going to be released first. And then they also are working on establishing how those videos are going to continue to be managed and looked at, over the years, and making sure that content stays up to date. Next piece is where they focused on the diagnosis specific. And so we went live, as Kaylee mentioned, with the asthma pathway in June of last year. This was a nice diagnosis specific content to go live with. One, there's robust education from Kids Health. Boston also had a few of their custom videos already available. And they had a great nurse practitioner that goes around and educates every asthma kid that comes in during the business hour times too. So they already had a pretty good program, so we looked at how can we enhance that program, provide another method of learning for the patients as well. So they went live with the existing pathway, and then the new onset, they actually ended up kind of tweaking and using an order set format for the new onset. This, I think, is so exciting. They call it their ticket home. And they actually just went live with this a few weeks back with their patients. But this is provided to every family and patient that comes in with that asthma diagnosis, and it lists down what they need to go through and review before they can be discharged home. Nurses are educated on it and encourage, to make sure that the families are following this plan. And then we also were able to add a little bit of education and pictures on how they can access that pathway through their Get Well. The next piece that we're looking at is, how do we simplify the system? How do we make it easier for people to use? In 2018, they did a pilot with their coach student rounding. So these were high school students that came to the hospital from July to August, and they went through and taught them about the system and asked them to go around and really teach the families and orient them to Get Well Network. Kristen was actually inspired to do this based on the last GetConnected conference, a presentation that another hospital had provided using volunteers. So those students also helped create an education handout to put in all of the rooms to give that added level of orientation. And they had really successful results with this. What they looked at as a whole was pretty much like, are they using the system? So they measured the number of clicks. And so they saw a 46% increase in clicks with patients and families that had been actually truly oriented on this system. And they did take into account the clicks that was offered during the orientation and deducted that out. One thing that I thought was really cool, Kristen said that she was rounding with a patient that had actually been at the hospital for over a year. And the kid said, like, oh my gosh, I didn't know the system could do this. So, they day in and day out for a full year, and there was still things that kiddo learned during that rounding. So I'm guilty of this too, of telling nurses, like, oh, it's technology. The kids will figure it out if you don't have time. I know there's other important things. And they will figure out the entertainment stuff. They'll find that Frozen and Moana video. But there's so much rich information that you guys put inside the system, that this added level of orientation, so finding the right person and the right time to orient the patient and the family is really important. Now, Boston did this pilot. They had great results, but they are still working on establishing a true program. So that's one of our ongoing goals. And then the next thing to simplify the system was we actually did switch to a teen-only experience in December. So Boston was live with both town and teen based on that age group. Especially with the asthma pathway, we noticed that in the town experience, they get the pathway, they get prompted, they say, no, not interested right now. where do they go to reaccess the pathway again? There's nowhere to go. They have to wait until the prompting time again. Teen experience, it's right there in their face, begin or complete my pathway. So it's so much more intuitive and easy to use. So we made that switch, and we'll continue to collect data and optimize that as we go. And then the last thing is, how do we make it easier for staff? So one thing that they did with their power chart, so they order through power chart and it does document back, but when the nurses were ordering the videos, it wasn't easy for them to see in the chart if those videos were actually ordered. And so those ongoing shifts, there wasn't anything in their face every day, so they know to follow up on the patient and get those completed. So they added to their patient care plan those orders on there, so it's something they're looking at every shift. Right there, oh, there's an active video, I need to go get my patient to watch them. And whenever it completes, it does gray out. So on to 2020, some of our goals is to re-implement super users. So I think most people do really great at implementation time, and then the super users fade off. So we're going through and trying to recruit more and train them up again. We're gonna do house-wide re-education. As mentioned, you see with that initial implementation, everybody's excited, our numbers are up, and then people forget about it and lose touch. So establishing a routine education plan. And then the last thing is also implementing a consistent orientation plan for all new employees that come in as well. So a lot of fun things I get to work with Boston on this year. All right, and we'll pass along to CS Mott.
Hi, so I'm Kathy Doherty from Mott Children's Hospital in Ann Arbor, Michigan. And let's get started. Let me get my glasses on. So this is Changing the Culture with Patient Education and Engagement Plan. And this is our why. So we've had Get Well Network for about the past 8 years, and we were so excited to start taking the next steps of integrating Get Well Network with our Epic system. In preparation for this next journey, we came up with our mission to improve our patient experience, enhance engagement with our staff and patients, and improve documentation of education. And I'm going to show you, these are our statistics, or our numbers. We are a 250-bed pediatric hospital with a child and adolescent psych unit. We have 50 birth center beds, and plus we provide child's emergency services. We are a magnet destination, and we are also a part of a large academic hospital in Michigan, as I said earlier, and we are not freestanding. What I really want you to know about our hospital is that it's a lovely place. I'm very, very proud of our hospital. We provide amazing care every single day, and the people that we get to meet and work with just makes me a better nurse every single moment that I'm around them, and we develop amazing relationships with our patients and families. So here is before integration, our education delivery system. So first, our RNs would assigns a patient care plan, and then the RN would go in, get out of Epic and go into Get Well Network, and they would assign education videos. We were fortunate, about 40% of our patients watched those videos. But then the nurse would have to go back into Epic and then document that, and that's where we kind of lost the loop. I don't know about your hospital and nursing documentation and education, but we weren't that great. Dang. But then the patient would be discharged. But now with the integration, we are doing it's such a win-win. We love it. So the RN will go in and assign a care plan. Then the RN assigns educational videos. The patient watches those videos. And then the patient answers a comprehensive question. And then education, yay this, the education is automatically documented. And then the RN actually has the opportunity to look at that and review the information and follow up with the patient. So here's our timeline. So our clinical practice design started back in February of 2019, and we had representation from all areas: nursing from each unit, nursing leadership, nursing informatics, educators, Office of Patient Experience, and respiratory therapy, and a tremendous support from our Get Well Network people. The individualized training for each unit started in July of 2019, and at this time the idea of a PEEP, which is a Patient Education and Engagement Plan, was created. This was our overall plan to help each unit change their personal culture in their area. As you might all know, too, the hospitals that you work at or the places that you work, each place has a little bit of a different culture, and so you really need to individualize it to have success. And then in August, each unit provided a PEEP explaining how they were going to incorporate, educate, and change their culture. Our next round will be coming up, and that's our future round 2, which will probably be more about touching base with the units and then also integrating more videos. So Sue's going to come and talk about the PEEP.
Okay, so this is a really busy slide because when we rolled out our plans to all the units, they each individualized it. So we do have some paper copies of this if you want to pick one up afterwards, and we're also going to have them upload it to the app. So the top section, each area came up with their goals of how they were going to educate their staff and utilize the system. And then the section down below highlights all the different people that are on the unit that can help with the integration of the education with the patients and families. So for instance, on this one here, we have unit host, and they help to educate the families to the Get Well system. And then we incorporated our text to help with going around and reminding families when they had education videos added. So we really wanted to change the culture in our unit around education, and part of that meant that we needed to include everybody on the team, from nurses to assistive personnel to therapists and so forth. And then the top upper section on the right shows how we were going to roll out that education. So we did have an online learning module for people to complete. We did a lot of one-on-one education, some posters, a little bit of everything, different ways. We know people learn in different ways, so we try to incorporate learning styles for all staff with different modalities. The next section looks at data collection, right? Because you want to be able to measure how well your education rollout is and your change is occurring. So one of the ways that we measured our unit was looking at the percentage of videos that were completed. And we also wanted to look at staff satisfaction with the better ease in ordering education videos. And then the bottom section talks about how are you going to make it fun, right? Because this is a big change. We wanted to have everybody bought into the process. This here is an example of one of the posters that we had put up for staff to do around education and trying to get some energy for this change to occur. And one of the things is, as Kathy had said, we were really going for a change in our culture, and we wanted to make patient education a priority for all nurses on all shifts, and we wanted to have that communicated at shift change. So this is just a little example reminding people to do that. And then remember, we talked about making it fun. So different areas came up with different ideas to get their staff built in and make it fun. So the one that says newborn discharge videos, it's not a screensaver. It's actually a tent card that you'd put up in the room. That way the staff could refer to it and the families could see that they had education videos ordered. And the bottom one says, be a smart cookie and watch your education videos. So this was something that we used with staff to remind them about the education videos. The bottom one that says Get Well Network, that was actually a magnetic card that was put around the doorways on one unit, so the staff would be reminded that the patient had education videos as well as the families. And the top one was from my unit. We came up with a theme of Pop on Get Well. And so when our staff completed their education, they all got popcorn. So what was the staff saying? As we started to roll out this education, we could feel the excitement building. So this is some of the actual things that staff would say. It's, wow, we actually have a project that's not more work, right? Because it seems like everything that comes to the bedside nurse just adds to their workload. But this one, they quickly recognized it was going to be a better workflow and that we'd have more families watching videos. And it just felt like it was selling itself. And what's more powerful than a patient story? So fairly soon after we had went live with our integration, we went around, did rounds on the units to see how staff was liking it, because that was part of our measuring metrics. So in this scenario, Christine was a bedside nurse for a toddler who had a new gastrostomy tube placed. So on Wednesday afternoon, she loaded up, I think we have 4 videos for education. She loaded that and assured the mom, who was very nervous, that she would be back the next day to complete the education with the mom. So best laid plans, right? Well, the next morning when she came in, one of her other patients coded, and so she wasn't going to be able to do the education. So we have team leaders, and our team leader, Diane, stepped in to do the education with the family. And what was really cool is she could go into the education tab and see exactly that the mom had completed watching the videos and was ready to do that hands-on care. So this was fantastic foundation for Diane, because she was able to go into the room and very confidently tell the mom she knew that she had watched the videos and she was going to do the hands-on teaching. So this mom, who was very anxious, quickly calmed down because she could see that communication, and this nurse knew where she was at and was able to start there. And what was really interesting is by loading those videos before we went to do the hands-on, this mom had really great questions. She was able to refer back to the videos and ask really point questions to clarify her teaching. So this is another story. It looks at how much that documentation that the families put in when they watch the video really drives our education plan. So in this video, in this example, a parent was loaded education related to NJ placement. And the nurse had added all of the NG videos, and the mom had put that she had questions regarding the placement. So when the nurse went in to look at the education, she noticed that the mom had questions, and immediately she thought, oh, that's right, this mom is not going to have to place the tube at home because it's an NJ and it's bridled, but I do need to cover with her what she's going to do if that comes displaced or comes out. So it really made it nice for her to be able to make her education very patient-specific. So we've really found this integration to be very helpful in how we approach our patient education. Now, Melissa's going to talk a little bit about some of our data collection.
So prior to the integration, we were ordering education through the management console, and part of changing the culture is we have been doing it for so long. Did all the training and all the education that we were doing work? Did we get people to actually start assigning through Epic? So this chart shows starting in August when we did the integration, and we've only been live for since August. It's been successful, and the fact that we've had 64% of our staff now ordering education through Epic. We haven't yet, part of phase 2, which we'll kind of bring up a little bit, is that we didn't integrate all of our education. And so in reality, it'd be a little bit more. People do still have to go into the management console to order some education. So 64% though are ordering the majority of the videos that people use on a regular basis, which is a wonderful thing. That means that we are seeing success. Here is our assigned video rate. And it looks back starting in April, and you can see that we're fairly steady all the way until we did our integration. And then with the training and the ease of integration, you can see that we did not only have, we're seeing an increase in the number of videos that we're assigning, which is really wonderful. This chart shows our ordered education completion percentage. We saw an increase from the beginning. So again, August is when we did our integration, and you can see it's at a low 40% to start with, and by September, we're already getting close to 60%, and now we're seeing a leveling, which is amazing. Please note that in July, we were already at our highest ever completion rate, likely due to all the work that we had preparing with the PEEPs, with every individual unit, and even though we hadn't yet integrated our technology. So the big increase, that 1 month, was likely due to the ease of integration, but more importantly, the overall increase, we believe, is due to the training and the change of culture. This unit right here, this is one specific unit, our birth center, and prior to integration, they really weren't ordering very much. They use their PEEP to focus on a particular workflow for a discharge instruction video. It was a priority for every bedside nurse to assign the video and ensure that the patient watched the video. Leadership, physicians, and bedside nurses all participated in getting involved, and it made a huge difference. We found that success is related to involvement on all levels. And as a side note, physicians involved in this unit are looking to expand it to other units. This is a win because physicians in our facility have not historically been involved in Get Well Network video education. After integration, we surveyed nurses to kind of see what they've said, and we have received nothing but positive comments. It's very typical. The one on top just shows that a nurse was able to see that the assigned videos were, patient was assigned videos, and even though they didn't watch it, the nurse knew what the next step should be because she was able to see it in Epic. How convenient it is to order the videos now, have one less step. Kind of go right through. So to be successful takes a change in culture, a constant effort from all levels, and working together as a team, we feel that we are stronger and unstoppable. But technology of integration is not enough to make a difference in patient education, and that's a really big lesson. Staff involvement and ownership play vital roles. So for our next steps, we know that we are going to do a round 2 of PEEPs, check in on people, and see what tweaks we need to make and what changes we have to do. We also are looking for meaningful data for each unit's culture. What's going to help each location encourage upward movement and sustain culture. Well said.
Any questions?
I wasn't sure how. Yep.
Turn off and on.
Is it on now? This is for the Boston team. Can you talk about the logistics of starting the asthma education? Like, how does it actually get? Who's responsible for doing it? If a patient's admitted for asthma, what does that look like?
Sure. So for the education plan, right now, it's very much usually owned by that nurse practitioner. What they've really been working on is making sure that the nurses are owning it too, because the nurse practitioner is not there 100% of the time. So that's what they're working through too, to increase their utilization. What was the teaching that went out was when the child's admitted with an asthma diagnosis, it's with that admission, they have both existing pathway and the order set for the new onset built within their orders. And so it should be selected at that time, but we didn't do a auto select of it just because they use the same order set for both new onset and existing. So somebody is still required to check that box. So the expectation is that both nursing team and the asthma nurse practitioner owns it, but so far it's been mostly the nurse practitioner that's been owning it.
Hi, I'm Amanda Stroud. I work at LifeBridge Health, and one of the things that we have identified is the opportunity to use TeachBack following the videos to confirm the education. Can any of you speak to how you've kind of worked through that with your nurses, or if you've implemented that?
Why are you giving it to me?
Because that's you. She's our educator.
So one of the things that we've really encouraged some of our staff to do is actually put the video on while they're in the room with the parent, because that really helps to facilitate where you're watching it together. And, I really like how Boston's has made a lot of their videos homegrown, because if you've watched a lot of the videos from Children's Health, they're very generic. So it's nice to be able to stand there and say, when the video says, you know, your provider will show you, that we say, oh, this is how we're going to do it. So we do a lot of that when we do a lot of the hands-on demonstration with families. So we usually have them practice on a doll first and then with the child. So that teach-back moments are there.
We also the videos really are just the very basic. We know, the nurses know that they have that whole other loop to complete.
it.
Also for the asthma teaching, that ticket to ride that they created, that's one reason I like that as well, because it's kind of an opportunity for the nurse or the educator to go in and make sure those are check marked, and so that's a key point to also do that teach back. So I think that that's a good opportunity as you continue to develop diagnoses specific work plans. I mean, your G-tubes, your trach cares, those are such a standard workflow that maybe those ticket to rides could continue to be developed for those as well. If you want to say it, I can repeat it.
Can you expand a little bit on the ticket to ride? Does it report back to anywhere?
So the question was, the ticket to ride that Boston uses, does it currently report back to anywhere? At this point in time, they don't necessarily collect it and make it a part of their record or anything, but it's definitely, I think, an opportunity. And for those who are integrated with GetWell, I think you could even build something like that into your GetWell system. But at this time, it's just the responsibility of the nurse and the educator and nurse practitioner to follow up on that.
One more question. So if one person marks off certain topics as checked off, how does it then go on to the next shift? Is it all on TV?
Yeah, so the question is, with the checklist, as they go through and mark off the ticket to ride for the ongoing shifts, how is that communicated? At this point in time, it's just the paper that remains in the room, and so they don't have it at all built into the system, because I know it's small to see on there, but they have other pieces of it too beyond the GetWell. They do have, the hands-on education with the spacers and everything, so that just remains in the room, and it's encouraged for the families even to go through and check it off, so it's encouraging the family and patient ownership as well.
We have a similar system too. Yeah, exactly.
That is.
I'll figure this out eventually. So we are at time. I appreciate everyone's attendance. Thank you so much to the presenters. You guys have been amazing.